Right, I'll get going. I won't waste another second. Thank you, and thanks to Lisa for inviting National Museums Liverpool to this event. We are the museum geeks in the room, my colleague Dawn and myself. I'm not Carol Rogers, I'm Claire Benjamin. Carol had to send her apologies today, but hopefully I will give it justice. Bit of context, we work within a city of amazing cultural assets. And I suppose just to put a little slant on why we're here today, the Innovation Agency, Department of Health, Health Education England, Merseycare and other partners who are here today saw our world, it's moving without not pressing anything. And they recognised innovation in what we did in the museum sector around meaningful conversations to support people with dementia. Now, we had a discussion in the break, is dementia classified as mental health? Should it be? But for the purpose of today, we're thinking about how museums can support family carers, support paid carers, can support acute hospitals, can support researchers. I'm not actually pressing anything, but here we go. Oh, no, can we go backwards? And what we're going to be doing is we've got an app and we developed it through the Innovate Dementia programme. So one of the questions a little earlier was around involving service users. We involved service users, we involved local SME Damabu here, Dave, who supported the app design. We involved university partners and we involved service users and clinicians. So it was a thorough approach to developing it. And simply what it did, it connected people with museum objects, but digitally. So we've got an amazing building. If you look through the windows, the Museum of Liverpool, for those who haven't been, go across the road at 1 o'clock. The museum is there for those lucky enough to be able to get there physically, but what if you can't? What if you're isolated? What if you're an older person living in a very vulnerable situation? And we worked with the Liverpool Clinical Commissioning Group at the time to develop an app because they were very much interested in digital innovation. And through the app, we were able to put loads of museum content into the app. It involves Liverpool content. It's actually, in terms of adopting it nationally, we're working with partners in London, in the Northwest, Northeast, the Midlands, Gloucester, Ireland, Scotland. We're actually going to be working with partners in the States as well because the concept is very simple. It's an app. You can put digital content in there and it really helps people with dementia respond to objects as a stimulus, to having a wonderful conversation, if you can have the conversation, but it may be just responding to a powerful piece of music, it may be responding to particular sounds, it may just help trigger those memories, and if you're their carer, you can use that to help pass the time in a very meaningful and passionate way. The next bit of it is about me, and we're working with Dave, and we're working with John Moores, and we're working with the Innovation Agency to think about how can you put personal content into the app. Because at the moment it's museum content, it's museum stuff, but actually a lot of people along the way have said to us, but we want to add our personal memories. Because in a sense, your museum objects have triggered a powerful emotion within the person with dementia. And they've got their own photographs, they've got their own pieces of video. And we have to capture this before, unfortunately, potentially the person, your family member, loses those memories. And through the app, you can capture it. And it's there to enjoy while the person is living and having some quality of life. But it's also there to capture memories, unfortunately, once those people have passed away. And it's just important to talk about gathering those stories with your loved ones, with the people that you care for, getting to know them as a person and capturing that digitally in a safe space and very much using the app, which is it's a free downloadable app and it's accessible and because it was developed with people with dementia and with carers, it's very simple to use. The design features on it. We've got wobble buttons if you forget where you are. And if you come to the session, we've got tablets with us and you can have a little play with it because it's actually better to use it yourself. Thank you.